This is Brent of the Brook Bush Institute, and in this video we're bringing you another manual technique. Now, if you're watching this video, I'm assuming you're watching it for educational purposes and that you are a licensed manual therapist following the laws regarding scope of practice in your state or region. That means athletic trainers, chiropractors, physical therapists, osteopaths, licensed massage therapists. You are likely in the clear to do these techniques. Personal trainers, this probably does not fall within your scope of practice, although you might be able to use the palpation portion of this video to aid in learning your functional anatomy in an educational setting supervised by a licensed manual therapist. Now, before we place our hands on a patient or client, it is important that we assess and have a good rationale for doing so. And of course, if we're going to assess, then we should be reassessing to ensure that the manual technique we're using is effective and we have a good rationale for continuing to use that technique. In this video, we're going to go over static manual release of the infraspinatus and teres minor. I'm going to have my friend Melissa come out. She's going to help me demonstrate. Now, in this video, we're going to use the same palpate and compress protocol we've used for all of our static manual release techniques, paying attention to how to differentiate these tissues from other tissues in the area, where our common trigger points are, what tissues may be in the area we shouldn't compress, and of course patient or client position and our position to ensure that we have good technique. Now, knowing where our infraspinatus and teres minor are is the first challenge, and to find out where they are, we really kind of need to know where the scapula is. Specifically, where is the vertebral border of the scapula, which I can feel right here. So you guys, I'm going to leave my thumb right there so you guys can see that border, and then the other border I need to find is actually the spine of my scapula, which is this bony ridge right here. All right, so that's just like that. And this area in here is your infraspinous fossa, which is the origin of your infraspinatus. So all of this right here is your infraspinatus. Now, your teres minor, if I put my finger down just like this, just to where her armpit starts to crease right there. Sorry, I didn't mean to tip you there, Melissa. Right, just where her armpit creases right there. When I press down in towards her shoulder, I can actually feel a little tube-shaped muscle right underneath the convergence of the fibers of my infraspinatus. All right, so they almost blend up in here. But if you guys kind of play around with, okay, palpating the tissues in this area, I think you'll find that your infraspinatus is a fairly lumpy muscle. You can really feel the different fascicles and groupings of fascicles in your infraspinatus as they converge onto this tendon, right, that goes into the back of your shoulder. And then just underneath that, you can feel this little tube-shaped muscle that is your teres minor. Now, common trigger points generally fall right in the corner where the spine of your scapula meets the vertebral border of your scapula, which that would be the root of my spine and my scapula here. But generally in this area, you get some pretty tender spots. How does that feel, Melissa? And I'm going to show you guys where those are marked off in the close-up recap, but we'll definitely look to palpate those. And then as the teres minor trigger point ends up like right in the middle of the muscle, which is going to be between the axillary border of the scapula and then the posterior portion of your shoulder. So you're going to be able to find a teres minor trigger point like in here. I guess you could fall off the posterior delt almost right into that trigger point. The big question becomes with this one is we do have something called your quadrangular space where your axillary nerve runs through. So if we're not careful how we palpate these tissues, you can get somebody's fourth and fifth finger to go numb or them to start feeling numbness in this area in general because you'll pinch off the axillary nerve, and that's a little problematic. It's not very comfortable. It's not something we want to do often. If you do manage to do it, try to remember that nerves are fairly thin. So chances are if you change the angle that you're going at that trigger point in, you're going to release pressure from that nerve or get off that nerve altogether. So the infraspinatus, we don't really have any contraindicated tissues that we need to worry about missing or not compressing. But when we get to the teres minor, we do have to be a little careful, as we could end up compressing down on that quadrangular space, compressing down on the axillary nerve, and giving somebody some uncomfortable nerve symptoms, including numbness of the fourth and fifth finger. All right, so patient position, your position. Now on this technique, I wouldn't reach crossbody. I would stay on the same side. Since these are our external rotators of our shoulder, to lengthen the tissue out so that I can anchor down these points of hypertonicity, these trigger points, I'm going to have Melissa do the hands underneath the ASIS thing. There you go. And then what I find it easiest to do is, rather than to be here at shoulder height, I'm actually going to go this way. All right, so these fibers run horizontal, kind of from vertebral border to the back of your shoulder. So I want to be able to strum this way, and then I also find it easier to lock down trigger points this way. This is just what I found personally. If you guys find it easier to go this way, that's fine. I think if I was this way, I would probably want the table a little higher, and I would make sure that I'm back a little farther so that I can just lean. Try to get into a position where you're not using your hand strength. So just as with all techniques, I'm going to do my perpendicular to the fiber strokes. So my fibers go this way, I'm going to run my fingers across the fibers this way and look for dense fascicles. And in the infraspinatus, it's a little challenging because they're all kind of dense. So you really need to do a good survey and maybe think about looking for the densest fascicles. Oh, there's a good one right there. And these tend to be really, really sensitive in somebody who needs this technique. So you need to go in gently. Only push until you get a little pushback from the tissue. Once you feel that tension start to increase, that's all the pressure you need. With this technique, I generally use my thumb over thumb technique, get my arms straight and lean, or I'm using my perpendicular stroke with one hand, and then the hand that's doing the perpendicular stroke, the feeling, once I've found it, that becomes my dummy thumb. I relax that hand and I use this hand to apply some pressure. I'm going to hold for 30 seconds to 2 minutes until I get a good release, and then I can go on to the next point in that muscle or the next muscle. In the case of the axilla, again, or the teres minor, I'm sorry, which is more in the axilla, we're trying to get in here. This technique, we're going to find that muscle. If it needs it, the whole muscle might feel pretty dense. So we're going to look for the tightest nodule, the tightest point within that muscle, which is going to be between, again, axillary border and posterior delt. We're talking about a space about yay wide. Right? And once I find that dense point, I'm going to hold on. I know you guys can't see this particularly well. I'm more interested in this view for you guys seeing. Notice my body mechanics are set up in such a way that I can apply pressure this way and down by essentially leaning in. My arms are nice and fairly straight. I can get into my thumb over thumb technique, or my thumb in a thinner groove here technique, without having to use my hands. The last thing I want to do is fall back on my hand strength, because if she is very athletic like Melissa is here and she needs a lot of work and I'm going to have to hold these points for 30 seconds to 2 minutes, like I'm going to wear out my hands. I want to get into a position where I can find tight fascicles, go along the tight fascicle to find the tightest nodule. Once I find it, I can just add my hand technique, get into a good position where my arms are straight, and I can just lean as much as I need to, which in this case is not very much, to get the pressure I need. And then I'm just going to wait for a release to happen. Stay tuned for a close-up recap. Now for the close-up recap of infraspinatus and teres minor static manual release, the first thing we need to do is really identify where the borders of our scapula are. So we want to find the vertebral border of our scapula, and you guys can palpate there. Right, and I'm going to go ahead and lay my index finger down right along the vertebral border of our scapula so you guys can see that. And then I'm going to wrap the web space of my thumb around the inferior angle of her scapula, and then my thumb itself along the axillary border. So now you guys can kind of see I'm pinching her scapula, so you know where that is. The only other thing that I need to find now is the spine of the scapula. And the spine of the scapula is right here, so if I lay my thumb down there for you guys should have a good little visual image of where my infraspinous fossa is, which is kind of where my infraspinatus lies. So once I've found that infraspinatus fossa, I can go ahead and start doing my perpendicular strokes because I know all of these fibers converge towards her posterior shoulder. So I'm going to gently go through here. As I mentioned before, guys, if somebody needs this technique, these fascicles tend to get really, really tender. So I'm looking for that densest tissue, and not surprisingly, I'm finding my densest tissue right around these X's, which happen to be my common trigger point sites for the infraspinatus and teres minor, respectively. All right, so let's say we'll start with this one. Let's say this is the first dense fascicles I feel. I'll then go along the length of the fiber and see if I can find a tight nodule, making sure I don't go further than the vertebral border of my scapula. Once I've found that, I'm just going to do my thumb over thumb technique and lean my body in there to anchor down, apply some pressure, and try to get a release from these tissues. Remember, I'm only pushing hard enough to get a little tension back from the muscle. Once I feel tension back from the muscle, I don't need to go any further. I don't need to try to press through her scapula. Once I get a release, I can move on to the next set of dense fascicles, and I see some right there. Oh yeah, that's a nice dense set of fascicles. I'm going to once again kind of go along the length of those fascicles to see if I can find a tight nodule, right? An acute point of hyperactivity. And again, there's another common trigger point site. Make sure I can get this set of fibers in this particular nodule anchored down, and then once I do, I can use my thumb over thumb technique, or I can use my thenar groove over thumb technique. Again, holding for 30 seconds to 2 minutes until I get a release. Now, the only one that's a little tricky is I have to kind of fall off my axillary border way up close to where my humerus meets my scapula, being your shoulder, right? But right up in there, between these 2 points, is my teres minor. So here is my axillary border of my scapula. Here's my posterior shoulder. You guys see where this X is? That's actually the center of my teres minor, which feels like a band of tissue kind of underneath the converging fibers of my infraspinatus. So if I've already done a really good job of exploring the infraspinatus and I've felt those fibers going into the tendon, I can usually move just below that string of muscle fiber and tendon and find this tube-shaped muscle really high in the armpit, and then I just kind of have to search along the length of it to find the densest point, the nodule, again, and then I'm going to push up into the axilla there to anchor that tight nodule or trigger point until I get a release.
So there you have it. Knowing your functional anatomy will definitely help your manual technique. It'll help you differentiate structures so that you can place your hands where they need to be, as well as make you aware of the sensitive structures around the tissue that you're trying to target. Things like nerves and lymph nodes and arteries. Make sure that if you're going to place your hands on a patient that you have done an assessment and have a good rationale for placing your hands on that patient. And if you're going to assess, make sure you reassess to ensure that your technique was effective and you have a good rationale for using that technique again. Now with manual therapy, one-on-one live education is incredibly important. Please be looking for opportunities like workshops and mentorships and maybe even classes at your local university that can get you some one-on-one individual instruction, or at least some live classroom instruction, so that you've had a chance to be critiqued and mentored by somebody senior to you with some experience in manual therapy techniques. And before you bring this stuff back to your rehab, fitness, or performance setting, please practice on colleagues. There is no substitute for practice, and it is going to take a while to get accustomed to some of the techniques that we show in these manual technique videos. Don't expect to learn them in 2 or 3 or even 5 minutes. You want to have hours of experience under your belt working on various different body sizes and shapes, so that when you do get that first paying client, first paying customer, and you're really trying to make a good positive impact, really trying to promote better outcomes, you feel comfortable with that technique. I look forward to hearing about your outcomes and hearing your questions in the comments section of this video. I'll talk with you soon.